Hi, I'm Dr. Erika Krumbeck. Welcome to NatPeds Pro, where we break down evidence-based research and whole-body approach to pediatric care. This channel is for healthcare providers looking for clear, research-backed insights into treating pediatric patients with confidence. Don't forget to like and subscribe. Let's get started. Welcome to the NatPeds Pro podcast, where we dive into evidence-based natural approaches to pediatric health. I'm Dr. Erika Krumbeck, and today we're talking about something that every parent encounters at some point: coughs in kids. We'll be discussing some common over-the-counter cough medicines and why many are not safe or effective, and why honey is a superior option for children over 1 year of age. So let's dive in. Dextromethorphan. Multiple studies, including one trial I'll post below, found no significant benefit of dextromethorphan over placebo for reducing cough symptoms or improving sleep quality in children with coughs, colds, or other upper respiratory symptom infections. There are significant potential side effects that include hallucinations, dizziness, nausea, and risk of abuse at high doses. Can also cause serotonin syndrome if combined with other medications, things like SSRIs. Antihistamines, including those containing diphenhydramine or Benadryl. These are often included in multi-symptom cough and cold products, but studies show that they have little to no benefit in suppressing coughs. Worse, they can cause drowsiness, agitation, or in some cases, even hallucinations. There's also a potential risk for abuse. It's not well thought of, but it can be abused. Codeine and opioid-based cough suppressants are no longer recommended for children under the age of 12 due to the significant to severe risk of respiratory depression and even death in children. Guaifenesin, it's marketed as an expectorant used to loosen mucus, but actually there's very little evidence to support its efficacy in children. It can also cause nausea and dehydration if not taken with enough fluids. And then decongestants, those are things like pseudoephedrine or phenylephrine. These can increase heart rate and blood pressure, they can cause restlessness, and there's really not a lot of evidence to show much benefit in kids under 6 anyways. And then combination cough and cold products. Many parents don't realize that these products mix multiple medications, which increases the risk of accidental overdose. In fact, the FDA and American Academy of Pediatrics strongly advise against OTC cough medications in children under the age of 6. The other thing I want to mention is a reminder for abuse potential. It's not something we always think about when we have cough syrup on hand at home. The U.S. Substance Abuse and Mental Health Service Administration reported that in 2006, in one random year, 3.1 million people in the United States aged 12 to 25 years of age reported using over-the-counter cough and cold medicine to get high. That's really concerning. There's actually a potential for abuse for nearly all of these over-the-counter medications. As I mentioned earlier, codeine-containing cough syrup has the highest risk of abuse, but actually there are other medications in this list that also have it. So what's our alternative to have on hand then? I think the best research right now is for honey, which many people have already thought of for coughs. Honey's been used for centuries as a natural remedy for coughs, and modern research does support its effectiveness. Studies show that honey not only reduces cough frequency, but also improves sleep in kids with upper respiratory tract infections and coughs. So what makes honey so powerful? It does have antibacterial and antiviral properties. Honey contains hydrogen peroxide and methyl glyoxal, especially in Manuka honey, which is our most potent type of honey for antibacterial, antiviral, and anti-inflammatory effects. Also contains polyphenols, which is strongly anti-inflammatory. So all of these things together help fight infections and reduce inflammation. The anti-inflammatory effects also help soothe the inflamed mucous membranes. That reduces throat irritation and that cough reflex, so that tickle in your throat that makes you want to cough. Honey contains those flavonoids and phenolic acids that help modulate the immune response and reduce oxidative stress in the respiratory tract too. And then it's sticky and thick, and that has a nice demulcent effect that helps coat the throat and helps reduce that cough reflex, that sensitivity, and all of that helps reduce coughing in general. So dosing has been studied. The dosage recommendations for children age 1 to 5 years of age, and that's based on another study I'll post down below, is half a teaspoon. So children age 1 to 5, half of a teaspoon, that's 2.5 milliliters. Children age 6 to 11 years is 1 teaspoon or 5 milliliters. In children and adults 12 plus years of age is 2 teaspoons or 10 milliliters. It's quite a bit, actually. It feels like a lot, I think, for older children, but that is the studied and effective dose. It's best given about 30 minutes before bed for cough relief, and an additional dose can be given in the middle of the night. Research studies are positive. There's a 2000 study by Cohen et al. I'll post down below that found that kids given 10 grams of honey before bed have significantly reduced cough frequency and severity compared to dextromethorphan or compared to no treatment. There's another study that found that honey improved sleep quality better than dextromethorphan. And there is a 2018 Cochrane review that analyzed multiple studies and showed that honey is effective in relieving cough symptoms and improving sleep. Safety: we never give honey or any cough syrup containing honey to children under a year of age due to the risk of infant botulism. But for kids over the age of 1, honey is safe and science shows it is effective. So what's the takeaway from today's episode? First, the evidence shows that over-the-counter cough medicines just don't work. Secondly, OTC cough medicines carry significant risks, both from side effects, but really even more concerningly, there's a real risk for abuse. Then, as an alternative, we do have honey. Honey is a safe, natural, and evidence-based remedy for kids over a year of age. A simple dose of honey before bedtime can significantly improve cough frequency and sleep quality in kids. As providers, we can counsel the families in our practice on how to use honey to help children with coughs and how and why to avoid over-the-counter cough treatments. If you're a parent watching this video, please always consult your pediatrician before starting any new treatment, especially if your child has underlying health conditions. If you found this episode helpful, don't forget to subscribe and share it with other parents and providers. You can also follow us on Instagram for more evidence-based pediatric health tips. Until next time, stay healthy and take care.